So let's go over the financial driver checklist and what is the role this plays. Well, remember, after the personal injury attorney educational sales, we're going to make two offers for two financial driver case analysis. In other words, we're going to see what documentation is potentially missing, which will obviously hurt and limit the injury award. So having said that, this is the checklist you take with you. And what we'll do is you go over there. We're going to offer two, only do one at a time. Don't do both at the same time. And you're going to, when you go over there, follow this checklist. So typically, and you do want the attorney there, and he'll be there. So what you do is take out the checklist. They'll give you, pull out all the medical records. And it's just going to be just an incongruent group of records. It's not going to be in any order or anything. And of course, that's good news for you because you're going to know how to put it all together. So just go through the medical records and check off what you do and don't have on the financial driver checklist. Be ready for about 50 to 70% of the documentation not even having been done. Just be ready for it. That's pretty normal. And of course, that's good for you also. So having said that, let's walk through this. And then obviously you want to point out majors and minors. If this, particular category of documentation is really important for the injury award, you want to be able to point that out. If it's primary versus secondary evidence, you definitely need to know if evidence is primary. In other words, really important for that injury award. Or is it just kind of supplemental and it supports the injury award? Okay. So having said that, let's go ahead and walk through this. So it says, now this is done at MMI, and the patient should be at MMI. Remember, when we get to the attorney, their number one need is going to be immediate. In other words, they're going to, after the presentation, they're going to now realize how much documentation is not being done for their present cases that are kind of done with care, but they haven't settled yet. And that's going to be their immediate problem that you have to solve, which is fine. So go over there to the attorney's office, do it at their office, and walk through the financial driver checklist. And then all you're going to do is just walk through. So you can see here you got mechanism of injury, see if there was an accident report. And obviously we're going to look at things like position in the vehicle, angle of impact, weight of the vehicle, speed of the vehicle's pictures, and obviously that's going to tell us, what the position of the vehicle, the angle of impact tells us where the potential injuries are. And then was there a bumper impact, vehicle part damage? It just helps us again tell us more about the potential injury. Was there emergency room or emergency room report? Was there bracing? Did they do vitals? Was there cognitive concussion issues? Okay, so the mechanism of injury is real important. The bracing and all that, that's just supplemental, right? So then we go to the injury magnifiers. The top three injury magnifiers are the most important. Where the defense is up, joints locked out, was there a whiplash effect? And then I'll look for the other injury magnifiers as we go through the notes. We have them, we'll document them. And then we'll go through the subject to findings at MMI with the visual analog scale where they quantified. And then we'll go through the hybrid evidence, physical signs, whether it's antalgic, guarding, bruisings. And again, those are secondary. Active range of motion, you'll typically have that documented. You typically will not have passive range of motion with overpressure. That's typically not even evaluated. And that's where most of the problems are. Muscle strength weakness, you may or may not have that. Neurologicals, dermatones, reflexes, cranial nerves, classical coma scale. You may or may not have it, but it's not going to be relevant in most cases. Then you go to the orthopedic joint test, and of course some of these tests are way more important than others. Some of them are joint tests that are more important. Some are neurovascular, like Adson's, Wright's, or Phelan's. Those are neurovascular tests. So those aren't going to be as important. You're not going to find them as positive as much. Definitely foraminal compression. That's going to be your main one with direct compression distraction, brachial distraction, and Adson's. So that kind of gives you an idea of how important. And a lot of times those aren't even done. You'll be surprised those aren't even done. The most important test in the neck is not even done. Or the low back. Same with the low back. You got Kemp's, sitting vectors, Lassex, Milgram. Same thing. Kemp's is going to be the most important test for the low back. And you'll find a lot of these aren't even done. And the category of palpation, you'll find that it's typically not even done. Remember, you're going to have about 50 to 70% of documentation that was not even done. And of course, with the palpation, we're going to look for fixation, tenderness, and muscle guarding. That's typically not done. Or if it was, it's not quantified. Remember, we always have to quantify these. Functional capacity, the indexes, whether it's the neck or the low back, those are typically not included in the attorney's notes also. Those are important indicators of ADLs as the patient's progressing through care. Then we go into the objective signs, which are the most important. And of course, you got the height, weight, blood pressure, etc. Those aren't going to be, those are standard and customary, but they're not going to be relevant. Then you're going to have the cervical x-rays. You'll typically have stationary x-rays. You typically will not have motion x-rays. And they definitely will not be measured. So that you're going to find, and of course that's where the majority of the problems are, especially with low impact soft tissue spinal injuries. So you'll find that essentially, 90% of the chiropractors never even heard of AMSI, and then the ones that have heard of AMSI, that's the only thing they know. They don't know of any other spinal lesions. So that leaves a wide open opportunity right there. And again, just be ready for you not to find it. It's not going to be there, which again is good news for you, because that's where all the injuries are. So, and then you should obviously know the difference between a primary and secondary finding, how important a primary is versus a secondary x-ray finding. And then same with lumbar x-rays. You typically won't find those, the motion x-rays at all. So in other words, this is where there's going to be a lot of objective findings they will not even have. And remember, they won't even know it. Because remember, they're in a state of unconscious incompetence. They don't even know what they don't know. And so you just need to, as you go through this, and just keep pointing out to them what they do not have, and then comment on it. How relevant is that documentation? Well, motion x-rays are in the objective category are the single most important finding there is after there's a mechanism of injury. Okay, blood test. You're not going to find those. They're not going to be done. We'll talk about the relevance of how that's supported. You typically won't find Dynarom done either. And then also, again, the relevance of that. Remember, a lot of times you have positive aberrant muscle firing with Dynarom when you have these altered intersegmental spinal lesions. And then most of the time, you won't have an MRI, CT, or CAT scan, and it definitely won't be positive. Remember, less than 32% of the cases have a disc component. Less than 16% have a nerve component. So you're not going to have those findings. That typically, you won't even have the test. And if you do have the test, it'll be normal. And I explain that to the attorney. I share with them, said, less than 32% have a disc, less than 16% have a nerve injury. I explain all that. Okay, therapeutic protocol. Was the treatment based on the science of the three phases of healing, the inflammation, repair, and remodel phase? Home therapy. Now that becomes really important. Remember, if there was a lapse in care from the point of the injury to the point which they sought medical care, remember that's when digging really deep to see if the patients had any home therapy care, or if there's lapses between treatments. This is when documenting home therapy, the different types of home therapy become really important. And again, I'm going to be explaining that to the attorney because that helps support that argument, because that's a common argument when they don't seek care immediately or there's lapses of care. The attorneys always bring that out to help minimize the injury. And so you got to dig hard to find these home therapy, whether it's rest or ice packs, or they've altered. Inhibiting and altering movement is home care. You're trying not to injure yourself. So then there's the response to treatment. Were the biomarkers quantified? In other words, how are we going to know if the patient's getting better, worse, or staying the same? Did they have a second opinion from another medical team member? Were there complicating factors, the most complicating factors? Did they take time off from work? Did they must perform activities of dealing, must work? Did they have to work? Medication's important. Remember, the primary reason for medications we're looking for is that it's a complicating factor. It inhibits, a lot of times the medication can inhibit collagen synthesis, but it'll give a false impression that the patient's doing better than what they are, and typically the patient goes out and re-injures or exacerbates their problem just because of the false sense of security they had through the medication. And then there's maximum medical improvement. What did the patient reach MMI based on the science of the 3 phases of healing? Most attorneys will not know that. They won't know the meaning of that. Well, the meaning of that is real important because you don't give an impairment rating until the patient's reached MMI, and the MMI is based on the science of the 3 phases of healing, and the therapeutic protocol was based on the 3 phases of healing, the biomarkers. See? Next comes the impairment rating and impairment indexes. AMA Guide to Impairment, most of the time you won't find an impairment rating because they didn't even do the test to find the impairment rating. A lot of times they don't even know how to do the impairment rating. And then you also won't have impairment indexes relative to ADLs. And remember, that's the two most important categories of the injury award is, was there an impairment rating and how did it cause pain or restrictions with ADLs? And you know that when attorneys don't even ask for an impairment rating, that tells you when they don't even ask for the thing that's most important to the injury award, what does that tell you about the state of their unconscious incompetence? How much they don't even know what they don't know? This is all part of you basically saving them. And this is where it takes some education too, how getting them to know, man, this impairment rating is important in many ways. Do we have the impairment indexes? Well, that's the second most important thing there is. How do these permanent injuries cause permanent restrictions in ADLs in specific planes of motion? Maybe not in some planes of motion, maybe not in active range of motion. And typically they might just be limited to a certain 1 or 2 planes of motion, only in overpressure range of motion. And you should be able to explain the difference and know the difference and be able to document the difference, because it will not be in these notes. You will not find that either. And then the same with prognosis and need for future care. Do you know how to give the prognosis and need for future care based on the patient, not your opinion? And that's what's so important. It cannot be your opinion. And then the pre-existing injury, how to apportion the pre-existing injury. So these are all the indicators. And when you go over and do the financial driver analysis, you take this with you, you're going to find out that pretty much half of this to 70% of this form and documentation has not even been done. And of course, that's great news for you because you're showing them. And remember, what's happening is there's becoming a shift because they don't know all this. They don't even know what they're missing. So there gets to be a great shift of unconscious incompetence to conscious incompetence and how much there is being missed. And of course, you're explaining it as you go through. And then they see how much is missed. And then, of course, then you have them refer the patient over to you to document everything that was missed. Because the patient should be at MMI right now. So whatever you find should be at MMI and permanent. And then you get the impairment rating, put it into the narrative report, make sure that you do the impairment indexes, and then you put it into the 12-step narrative report. Then you come back, you do a couple things. Number 1, remind them all the documentation that was not done first. Number 2, show them all the documentation you did. Number 3, of the documentation you did, what was positive. And then number 4, you take all the cumulative documentation, put it in the 12-step formula, and that shows them that you not only know how to document, you know all the categories, but now you know how to lay the case out, to support, to chronologically and logically put the case together and tell the story and support the injury award. And that's when a tremendous amount of authority and trust gets shifted over to you. And by the time you finish the first one, and then remember, I said if you need to pay for any diagnostics like a Dynarom or X-rays or whatever, you want to do all this for free if it's just your time, do it for free, because that's not about the money. We're trying to establish the relationship. It's not about a few $100s. It's about millions of dollars in the long term of the relationship. So we want to, if there are costs involved, you need to let them know before there's cost involved. And then let them know the reason. We need these x-rays and it costs this much. Is it okay? We need to do this test. This is the meaning of the test. And this is the cost of it. Is that okay? See, that's what that would sound like. And of course, after they understand everything that's missing and what's here, you're not going to have any problems with them saying, yeah, go ahead and get it done. Because you're not talking about that much money anyway. I mean, if anything, you're probably talking about maybe the blood test, the x-rays, and Dynarom. It's probably all you're really talking about when it comes to additional funding. So you're not talking about much. And then there you go. That's how you do the financial driver checklist. And at the end of the first one, that's when you really have won them over. You've actually shown them that you know how to do it. Now remember, the single most important thing to get across to the attorney is not that you know AMSI. It's not any singular diagnosis. It's that you know how to document all the major categories. Then you know how to put them in the 12-step formula to support the injury award. That's what's important. So don't worry if you do a test and it's normal. I'm going to let them know about all the tests, and I'm going to let them know if each test was normal or abnormal. That's not what matters, if it was abnormal or not. What matters is that they know that you know how to evaluate it and document it. If it's there, you'll find it. And then you know how to put it together. That's the key. That's everything. Then go for the second one. Now, by the time you do the second one, it's a cakewalk. They just want to give it to you now because now they see you know what you're doing. And then typically from this point, do the same thing. And then typically from this point, they ask you to typically be their expert witness for their other cases because they know they don't have anybody like this that can do this. They've never had anybody do what you've shown them. How to stop bad documentation and how to get it right and how to put it all together to stop the lowball offer and support the injury award. They've never had anybody. You know, they're typically getting cervical sprain strain with all their cases with a big fat bill and terrible documentation. That's typically what they're used to getting. So do the second one, and again, by that time they just do it, and you're in. You're in, and then there has to be the consistent follow up from that point forward. And then remember, every time you do a narrative report for an attorney, you want to meet with them and point out all the positive and negative categories and point out how you put them together and created in the 12-step formula to support the injury award. Number one, it's another great opportunity for you to create authority and trust and to remind them that they're not going to get this from anyone else but you. And so that's what you should always do with your narrative reports. And then the two questions you should always ask the attorney after every case. Number one, did you get the injury award you expected? That's the first one question. Second question should be, what could we have done better? Those are the two questions you should ask your referring attorneys every time. It tells them you're watching out for them. But here's what else happens when you say, is there anything else we could have done better? Typically, it won't be a documentation. It won't be a doctor problem that they'll ask you. It might be something administrative or service-based, and then it's good to clean it up. You know what that attorney may expect or want that maybe you didn't do. So, but what it tells them is you're looking out for them. That's what it tells them.